Absolutely. Yeah. So for anyone that has gone through, whether themselves or a family member that has had cancer, it's a tremendous life event that can be extremely impactful and a burden, not just for that individual diagnosed with cancer, but really their partner and their family as a whole. So it can affect anything from their physical health to their emotional and mental well-being. There's major financial burden that can come along with it. And that's one of the things we looked at too in this is it can also have an impact on the relationship between an individual with cancer and their partner, as well as the family at large. Cancer becomes the focal point, the forefront for that group or that couple. And so it's some of the things might go a little bit to the wayside, which can cause some potential strain in a relationship. Yeah, so this was a smaller analysis from a larger study that was done where we wanted to look at overall quality of life and well-being of breast cancer survivors compared to controls, so individuals that were similar age that did not have cancer, to see if there was any differences in those quality of life and well-being. And for this particular study, we really wanted to look at if there was a difference in terms of how satisfied cancer survivors and their partners were in the relationship, and compare that to those controls and their partners, and then see if that difference had any impact on certain outcomes related to physical and emotional health. And so again, yeah, we really wanted to see is, does cancer have an impact not just on that relationship strain or that agreement within the relationship, but then does that relationship concordance to that agreement, does then that have an impact on the physical and emotional health for the cancer survivor as well? I think one of the biggest surprises we found is that there was no difference in how cancer survivors rated their relationship satisfaction compared to how those age matched controls that didn't have cancer. There was no difference in the individual relationship satisfactions, but when we brought in their partner scores, that's where we saw a difference. It was slight, but it was enough that it was a noticeable difference that cancer survivors and their partners had a larger difference in their satisfaction scores compared to those controls and their partners. On the scale we use, it was a difference of about a two. Um, and so then that was interesting. And then when we took a look at how that difference within the cancer survivors then played for their physical and emotional health, we saw that the larger spread that you had between the survivor and their partner, the worse their depression was, the more fatigue they had, the more difficulty with sleeping. So we saw certainly both a physical and an emotional strain that it put that if a survivor and their partner are not having close relationship agreement with one another, then that kind of has rebound effects for the cancer survivor themselves. I think the big takeaway message for us is that a lot of both healthcare and research within this area primarily has focused on just the individual diagnosed with cancer or the cancer survivor in the past. And so I think the big message for us here is that we really want to not just focus on the individual with cancer, but make it sort of a team effort and making sure that we're listening to their partner or their family as a whole and including them in clinical decision making, or if we're building an intervention for research, that we're taking into account the needs of the partner as well. Because we feel if we can focus on the emotional health for both the survivor and their partner, it can help reduce some of that potential relationship strain, which we see through this study. If the lower that strain or that relationship agreement is, then the better some of these physical and emotional outcomes are for their survivors.